For the second time in a week, the number of people in intensive care units for COVID-19 in France has risen. That number now at 384, including 29 new admissions in the past 24 hours. Despite the recent uptick in coronavirus cases in recent weeks, the government has continued to say this is not the dreaded second wave. But on Monday, Prime Minister Jean Castex visited the northern city of Lille, urging the nation to keep its guard up. Local and national governments are struggling to find a balance between encouraging citizens to boost the economy by taking holidays and avoiding another lockdown. For more, let's go live to Durham, North Carolina to speak to Gavin Yamey, who is the director of the Center for Policy Impact on Global Health and Public Policy at Duke University. Thank you for joining us. As we've just said, authorities are struggling to find the balance between reviving the economy and avoiding a situation where the virus begins to spread out of control. Do you think walking this fine line will be feasible in the medium term, and if so, for how long?
Thanks very much for having me back on your show. Look, I think that the first rule of viral economics, if you like, is you've got to control the virus, right? You can't boost the economy if transmission of the virus is out of control. So the best thing that you can do for your economy is to make sure people are not being infected. Now, some countries have decided that that's their priority, and they've made it their strategy, a so-called going for zero strategy, if you like, where they've brought community transmission of COVID-19 down to practically zero. Places like New Zealand, Taiwan, I think Scotland is getting very close to almost eliminating community transmission. Under those circumstances, then it becomes a lot more feasible to reopen the economy. Having said that, you still want to take precautions. You want everybody wearing a mask. You want everybody socially distanced. And we now know, because we know a lot more about the virus today than, say, 6 months ago, you want to avoid people being inside, particularly in poorly ventilated places. In too many parts of the world, we decided to open up restaurants and bars, and those have led to resurgences. So those are the precautions we really need to be taking.
That was actually going to be my second question. We've seen in the French city of Annecy, 40 people testing positive for COVID-19 after just a wedding last month. Is this going to be the future of the pandemic in the weeks and months? Be sort of super spreader events where there are just weddings and parties in closed environments?
Yes. So again, in the early days of COVID-19, you will remember so much of the focus was on potentially picking up the virus from touching surfaces or opening your mail. We now know that the risk of that is actually much lower than we thought. We now know, on the other hand, that the risk of airborne transmission is greater than we initially thought. The World Health Organization is still saying the greatest risk is from large droplets, right? And that's the reason for the 2-meter rule. If someone is infected and they cough or they sneeze, those large droplets should fall to the ground within 2 meters. However, we also know that there are small particles, aerosols, that can carry the virus. And these super spreading events that we've seen in places like churches or karaoke bars or offices is more likely to do with these aerosols. And that's why it's so important that people start to get the message that being inside, particularly in poorly ventilated spaces, around other people, large numbers of people without masks, is a high-risk situation. I'm particularly worried, of course, about the reopening of colleges and universities, including here in the United States, because I worry that some classrooms are not well ventilated. I worry that not every student is going to be in a well-fitting mask, and some lessons can last hours and hours, and I think those could potentially be super spreading events.
Very, very quickly, because we don't have much time, we saw 150,000 students return to school in one region of Germany this Monday. What needs to be done to keep those children safe?
Again, the first thing, and I'm sorry to sound like a stuck record, the best thing you can do for safety is to bring down community transmission. If you look at the places that reopened schools, colleges, and universities safely, they first brought down community transmission. If you've done that, then there are other precautions that must be in place. You want small class sizes. Ideally, if possible, teach outside for ventilation. Everybody in a mask, teachers in full protective equipment. You want good sanitation, you want hand washing. All of those precautions should be in place. The greatest risk, of course, is that children transmit it to teachers, to other staff, to bus drivers, and to the community. And that's who you should be thinking about first and foremost.
All right, Gavin Yamey, thank you very much for your insight. Director of the Center for Policy Impact on Global Health and Public Policy at Duke University. Thank you for your time. Now to Italy.